So the guidelines supporting the administration of insulin in schools. It was very important to me that these guidelines had not just the NHS logo on the bottom, but also Nottinghamshire County Council and Nottinghamshire City Council. The guidelines gave clarity to schools as to what their responsibilities were with regard to children with diabetes. SENDA is the Special Educational Needs and Disabilities Act and requires reasonable adjustments to be made to prevent the less favourable treatment of disabled pupils. And diabetes is a disability within the definition of this Act. So in other words, if a child with diabetes wants to stay behind for football after school or wants to go on a residential, they can't be prevented from doing this because of their diabetes. Their parents can't be made to go when the children go swimming if other parents aren't going. And the duties of the sender are also anticipatory. So in other words, schools should actually be preparing for a child with diabetes before they even enter the school. The Disability Discrimination Act requires schools to promote equal opportunity between disabled and non-disabled pupils. And the guidelines also make it clear to schools that their managing medicines policy, of which I supposedly saw many but actually didn't, should have a plan which puts in place that if a child needs medication during school, they get it, and they have a plan as to how that's going to be done. And school staff also have a responsibility to act like any prudent adult and to keep children healthy and safe. And in some circumstances, this may extend to administering medication. But what it also makes it clear in the guidelines is that the schools will be supported and trained by the diabetes specialist nurses, and that if they have been trained, they will be covered by the local authority's public liability insurance. It also says to schools that they can submit their healthcare plan for that child to the local authority for consideration by the Medical Healthcare Needs Panel for financial reimbursement for the time it takes them to carry out the procedures. So the guidelines went to all schools, but often, as we know, guidelines go to places and they never get read. So we wanted to be able to launch the guidelines and also provide some diabetes training for schools. And in November 2007, that's exactly what we did. And then that training continued every year after that. And last year, I organised and ran 3 training sessions for schools with 120 delegates from 70 different schools. The training was a true partnership, with the local authority being responsible for the administration of the event, and the training being provided by the local authority and ourselves from health, free of charge to schools. We held the training over a morning at local hotels. Initially, there was no problems with the funding. Of course, since 2007, the political climate has changed, and last year there was no funding from the local authority, and I was very fortunate to get some money from Roche Diagnostics to be able to do the training last year. The programme for the training, we did some formal sessions on all aspects of diabetes, and they were delivered by all members of the healthcare team. And we also had some practical sessions, some workstations where the delegates could go round and have a look at all of the blood glucose meters and look at the insulin delivery systems. All sessions were evaluated, and most sessions scored between excellent and good. When asked the question if the delegates' aims had been met, 100% said they had. The practical sessions always scored higher than the formal sessions. And because we were getting more and more patients on pumps, in 2010 we added pump therapy to our programme. This is just an example of one of the evaluations that we had. But I also wanted to know not just about how delegates felt on the day that they attended the training. I wanted to find out for them to consider what impact the training session had had on their knowledge and confidence in managing diabetes when they got back to school. And in 2010, I sent a postal survey to all the schools who'd attended. I had a 38% return, and 100% of those people said they felt more confident overall. They were able to manage hypos, perform blood glucose checks, and administer insulin. And interestingly, 89% of them also, when they'd gone back to school, had fed back to their colleagues about the training session. What other outcomes have there been? Well, if children who attend Nottingham Children's Hospital need insulin in school, they get it. Attitudes are very definitely changing within schools, and this was pointed out to me by a colleague who went away and did some research for a year. When she came back and went into school to ask them for a volunteer to give a child their insulin, she was very pleasantly surprised that this was no longer a delicate minefield of negotiations. Children are accessing the whole curriculum. The guidelines continue to be available to schools, and parents have told us that they feel more confident. The en masse training continues, as do the individual visits to schools by the diabetes specialist nurses. Wider outcomes are that the guidelines have been recognised as good practice by these professional bodies. And we've also had advice sought from across the country and as far afield as Canada. We were very lucky to be a Community Partnership Finalist Award in 2010. And the icing on the cake for me was that I won this QIC Diabetes Gold Award the day before I retired for the Best Integrated Care Initiative. The training for schools will continue, and prior to finishing I did secure funding for this year. Points that I would like people to remember are: don't give up. If you come across a problem like this, it isn't going to go away, it's only going to get worse. But on reflection, for my own self, I think the way that I was treated, the traumatic events in the schools that I encountered, were probably because those staff were afraid and they needed support and encouragement. Actions always speak louder than words, and the person that I was very fortunate to come across was Liz Mangle, who was prepared to help with this. Keep everybody on board, keep them up to date with what's happening, share the evaluations with them. And of course, success is good for everybody. I'd just like to end with the quote from a parent, which I think sums things up rather well. As the parent of a young child with diabetes, you just want to know that they are safe, that they receive their insulin when they need it, and that they are not being treated differently from other children when at school. The service now available in Nottinghamshire should be available everywhere. Thank you.